Hey guys, so quickly have a list. Yeah, we'll just talk about a list of all the possible disorders of hemoglobin synthesis. All right, like all the examples of disorders of hemoglobin synthesis. Anyhow you want to actually put it. Okay, so these ones you see them sideroblastic anemia. This one is porphyrias. This one is myelodysplastic syndrome. This one is hemoglobinopathies and all of that. So for sideroblastic anemia, we say that this one is well, in general, hemoglobin synthesis disorders could be acquired or inherited. Right, may actually result in what distinct diseases. Right, for example, sideroblastic anemia. Right, so this one, there are a group of blood disorders in which the blood has enough iron but is unable to use it to make hemoglobin. As a result, iron is now accumulating in mitochondria of red blood cells, giving it a ring appearance to the nucleus. You understand? Porphyrias now. These ones are a group of metabolic disease resulting from derangement, usually of a genetic nature, okay, in the activity of specific genes in the heme biosynthetic pathways, right? So there are a whole lot of um, enzymes that are needed for heme synthesis. So the enzymes are lacking. Now, all of these porphyrias will actually be talking about them. All right. So don't need to stress on anything. All right. So this one is just talking about all those enzymes. So all those enzymes are kind of like lacking. So 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 it will now lead to what overproduction or accumulation of pathway intermediates. Those ones are supposed to now progress to become heme because there are no enzymes to break them down. They now accumulate in the body. You understand? The Myelodysplastic syndromes, which is a heterogeneous group of what closely related clonal hematopoietic disorders characterized by one or more peripheral blood cytopenias. Alright, like either maybe red blood cells are lacking, white blood cells are lacking, platelets are lacking. Do you understand? So if red blood cells are lacking, that's anemia. White blood cells are lacking, that's leukopenia. Platelets are lacking, that's thrombocytopenia. Understand? So any one of these can actually result. Okay. So it's now the way you understand dysplastic. That means the normal tissues of the bone marrow kind of like be replaced with some, how will I put it? Some fibers and all of that, you understand? They are not actually the normal tissues there. Then we have the hemoglobinopathies. These ones are stuff that actually affect hemoglobin, structural that affect the hemoglobin, right? Like the thalassemias. We have the alpha-thalassemia, we have the beta-thalassemia, we have the sickle cell disorders and all of that. You get? So this is it for the examples of disorders of hemoglobin synthesis. All right. So that's it, guys.